Hi, do you snore, have sleep apnea, or temporomandibular disorders, such as popping, clicking, grinding, pain in the jaw area, or locking of the jaw? This can lead to headaches, earaches, or facial pain. So, hi, I am Melanie, and I am an orofacial myologist and an integrative nutrition health coach. What is oral facial myology? Well, I'm going to define that for you today, and I'm also going to talk about the vagus nerve and connect these two pieces together that are so important. So, oral facial myology is the study and treatment of oral and facial muscles as they relate to speech, dentition, chewing, swallowing, and overall mental and physical health as described by Neo Health Services. I'm going to tie that into now the vagus nerve. So the vagus nerve is our 10th cranial nerve. It's hugely important in so much of what goes on in our bodies. It's getting a lot of attention these days. So the vagus nerve is involved in processes of us feeling full or hungry, sweat, regulating that, having constant heart rate, promoting kidney function, maintaining blood glucose, fertility in women, releasing bile. It's just involved in so much. And we've come to learn that having the vagus nerve tonified, working properly, means that you get to digest food well and be in a more relaxed, parasympathetic, as we call it, state, which is more of a relaxed state rather than this fight or flight that we're in too much these days. I'm going to connect those two pieces together in a moment, and I'm also going to talk more about symptoms of what a myofunctional disorder would be and how we solve that in myotherapy. So, the person who practices as a orofacial myologist would be typically a speech pathologist like myself, or sometimes dental hygienists do this kind of work. Now, what is it? What does it mean? So, we typically see clients who have tongue thrust or improper chewing and swallowing. This causes wear and tear on our muscles or teeth. Also, we work with people who have an open mouth posture. Let's say at night, sleeping with your mouth open, or during the day, not having your lips sealed. Look at this picture of a mouth breather. Look how breathing out of your mouth changes the entire structure, really, of your face. Another thing that we work a lot with is clients who aren't breathing properly and who snore or have sleep apnea. It's really important to sleep with your mouth closed because we produce this odorless gas called nitric oxide. And according to Heidi Dickerson, a dentist and expert on nitric oxide and mouth breathing, nearly 80% of the population breathes incorrectly. Check out this article on the importance of nitric oxide and nose breathing. In addition, long-term issues related to not breathing properly, that would mean inflammation of the gums, tooth decay, muscle weakness, neck and shoulder pain, poor sleep, face tightness. And I'm going to go a little bit deeper into how that relates to the vagus nerve. According to world-renowned Dr. Axe, he's a chiropractor and a nutritionist, doctor of natural medicine. He states that having proper nitric oxide helps with lowering blood pressure, sexual function, vasodilation or opening and closing of blood vessels, likely decreases blood clots, important for the immune system, and supports brain health. It's all in this article. So we know that, just to review, that having breathing properly and having proper resting posture and sleeping with your mouth closed, breathing through your nose throughout the day is really important for your health. Let's go a little deeper into snoring. Lots of people snore. We just talked about how nitric oxide is so important and how snoring is not a great thing. Let's listen to what this doctor says about snoring and the dangers.
Why do we snore? Why, when you see your patients, what's going on at night with their breathing?
Yeah, snoring is not normal. So typically, if you look at people initially when they used to come to me, oh, kid has been snoring. Oh, he's been snoring. I thought he was in a. It is a sign of deep sleep or good sleep. That means he's actually sleeping. But snoring is disturbing to your stability of sleep. For example, normally when we sleep and breathe, the breathing has to be quiet, and it has to be through the nose, and it has to be very restful, so that you are breathing through your diaphragm and at a respiratory rate between For example, for adults, it's 8 to 12 breaths per minute. Sometimes it's up to 15 and quiet. The moment your mouth breathing, it's abnormal, even though you're not snoring. And your snoring indicates that there is an obstruction in the path to the breath. From the tip of the nose all the way to the vocal cords, there can be any obstruction, which could be turbinate hypertrophy, adenoids, your soft palate, your tonsils, or back of the tongue, or your epiglottis, which is your voice box, can be floppy and block the airway and cause fluttering sound to your breathing, so that you increase the stress of breathing. And those patients tend to go into lighter stages of sleep, and they tend to have a frequent awakenings, what we call as micro arousals, that they may not be awake and aware, but the brain goes into light sleep. So they tend to be very fragmented sleep, and they tend to wake up feeling less rested and more tired.
And I'm asking, is there a connection between longevity and snoring?
I think if you look at that, the disease burden or the snoring burden, some patients start snoring from childhood and they continue to snore because somebody did not bring to the attention, or it got better and came back. There are new research coming up now. The patients, the longer they snore or they have later treatment of sleep apnea, there is a higher risk of Alzheimer's and dementia.
Right.
And also in patients who have significant sleep apnea and snoring, untreated for a long period of time, can develop hypertension, insulin resistance, and also metabolic syndrome. And over a period of time, they're at a high risk of developing cardiac diseases. And there are also patients with untreated significant sleep apnea, the risk of early deaths, sudden cardiac death is quite common. So yes, it can affect the quality of the life, not only neurocognition, but also your duration of life. And it can cut short your life by increasing this cardiac dysfunction, ultimately leading to death.
Wow. So not breathing properly, snoring at night leads to diabetes, hypertension, and shortens your lifespan. This is not good. Moving forward, another thing we work on in myotherapy is temporomandibular issues. Like I was talking about, the clicking, the popping, right? The tightness here, which can lead to shoulder, neck pain, headaches. It's really important to have proper resting posture and have your tongue in the correct place, and so that you don't have that. In addition, the vagus nerve, which I had mentioned before, we share source nuclei with the facial muscles. So the vagus nerve, although doesn't pass through the face, it shares source nuclei. And so if you're having a lot of tightness and a lot of tension here because you're using your muscles improperly, then that would result in your vagus nerve not working properly. So it's really important. Another thing we deal a lot with is negative oral habits, such as for kids, thumb sucking, or pacifier use for adults sometimes, and kids, nail biting. All of this, is very likely to lead to a need for orthodontia. So when you do the myotherapy and you eliminate these negative behaviors, you can prevent the need for braces, or also the need to get braces again because your teeth have moved because you don't have the proper resting posture. In addition, if you have a lisp, or your child has a lisp, or difficulty articulating certain sounds, a lot of that has to do a lot of times with having proper resting posture, using your muscles appropriately. So we work with that, as well as facial muscle weakness, such as drooling, or poor muscle function, which leads to poor facial growth. Check out this picture. You can tell with this photo what improper resting posture can do. You can get tired eyes, crooked teeth, crooked nose, smaller airway. And this could, again, lead to the need for orthodontia. And if you don't do myo, as I said, the teeth can grow back improperly. Another thing we deal a lot with is tongue tie. So what is that? That is the little piece of tissue that
attaches to the floor of the mouth.
And many people have this. Most people have this. Some people don't. The issue becomes when it restricts your range of motion. And when that happens, you can end up having just not eating and swallowing properly, having improper wear and tear on your teeth, for example. And we're going to actually talk more about how that relates to your overall posture. In addition, having proper resting posture of your tongue on the roof of your mouth, that is really important for the rest and digest state, the vagus nerve working properly. Oftentimes, if you're in a meditation class or something, they'll tell you, have your tongue elevated to the roof of your mouth. If you have restrictions, lingual restrictions, and your tongue is resting on the bottom of the mouth and not on the top, well, then your vagus nerve won't have that proper stimulation. What we do in myotherapy, so now I'll get into some solutions, is we work on correcting the improper resting posture in the mouth, right? So that's super important, as I was saying. Now, how this all relates to posture is, you're not going to believe this, but actually the tongue position in your mouth influences the balance of the cervical spine. So we have this connection of integrative network of fascia that connects all the way from our tongue to our toes. A lot of times I'll work with clients who don't have good posture and also have tongue tie. It's very interesting connection that the tongue connects all the way down. Check out this picture of this boy before myotherapy and after myotherapy, and how his posture, his whole entire body had improved doing this therapy. Pretty mind-blowing. The good news is that obviously myotherapy can be very helpful. Many times there'll be other people on the team, such as an airway-informed dentist, sometimes chiropractor, ear, nose, and throat doctor, other people like that. But our main goals in actual myotherapy is to have proper nasal breathing, proper lip seal, proper tongue posture, and proper swallowing pattern. And believe it or not, you could be eating and swallowing wrong your whole life and not even know it. It's really crazy. So the best thing to do would be to get an evaluation by a trained orofacial myologist. And I do this work in Hillsborough, North Carolina. I see clients in person for this therapy, both children and adults. I'm also an integrative nutrition health coach, and I work with clients in my signature Gut Revive program, where we work a lot on proper breathing and getting that vagus nerve toned. And for that, I work both virtually and in person, combining the vagus nerve work with many of the other facets of health coaching that I use, such as diet and nutrition and herbalism and lots of other aspects, which you can check out on my website. So I hope you found this informative. You're welcome to book a free 30-minute consult with me if you're curious and want to see if this therapy or the health and wellness therapy that I do, if that is something that would benefit you. The health seeker in me honors the health seeker in you. Have a great day. Namaste.